I'm Christine Frazita, and I'm a licensed clinical social worker, and I have been a psychotherapist for about 30 years, and I work a fair amount with people with PTSD. It affects people's day-to-day lives in two ways. So in one way, it affects their emotional life, their emotional reactions, because from what we know about trauma and the way it affects the brain and the way it affects the body and all of the whole systems, that means that the people who have PTSD, it's almost like their nervous system is much more sensitive. And so when things happen, like sudden noises or any kind of reminder of the trauma, before they even think about it, their whole body's reacting. And so when their body reacts into like a fight or flight mode, it means they feel a lot of anxiety often, or they feel a lot of fear, or they feel a lot of anger and irritability, like to push back. And so they often are just say that their day-to-day lives are more of an emotional roller coaster sometimes. And then the other way that I see a lot is that affects their sleep. Either they have nightmares, so they wake up feeling tired and distressed, or they don't have bad dreams, but they just can't fully sort of get into sleep. Or sometimes people are afraid to fall asleep because they'll have bad dreams. And so they develop these like bad patterns where they just don't sleep very well. And of course, if you don't sleep very well, that affects your day-to-day functioning. People are tired, people are more irritable, people are more forgetful. But the other thing I was going to talk about that I see all the time, and I probably work with the most, is how it affects people's belief systems. If they were abused by someone, they develop beliefs like you can't trust anybody. And so then those kinds of beliefs really affect their day-to-day lives.
My name is Philip Butler. I worked overall about 23 years working with veterans, primarily with post-traumatic stress disorder. I also spent a year in Vietnam myself. And the biggest aspect is what's gone on in their life prior to this specific traumatic event. So you want to find out the background for each person. And then you want to help them start to divide between what of their behavior relates to their background and what of the behavior relates to having been in a war. As you talk about this, they and you will both learn which is which. Once you've gotten to the point where you've worked with the way they interpret it and think about and the behaviors that come as a result of that thinking, then the next really step is to get them into a group of other people who've had similar experiences. And what you're trying to do is you're really trying to re-socialize an individual. The easiest place to start is with other people who've been in the same situations. There is a great deal that can be done in group therapy by pointing out someone's behavior in the group. They get to start trusting themselves and other people more. Because often what has happened to an individual is you don't know what a war is like until you get there. And often you feel deceived. A large portion of veterans tend to feel very deceived and mistrusting of authorities. Well, here you got a situation where they can start to trust other people, and that will branch out eventually to be able to trust other authorities, the group leaders being one. In the group, it's really about socialization, getting people out back in the world, feeling safe, learning how to communicate better, to be able to read their own states emotionally, and use that information to have a better outcome.
I'm a nurse practitioner with a training in psychiatry, and I work at San Francisco General Hospital in the methadone clinic there, where we treat patients who have opiate dependence or problems, abusing opiates. But a lot of our patients there also have concurrent psychiatric problems, and obviously a lot of medical comorbidities as well. I think PTSD is one of the most common diagnoses among the patients I'm seeing. I'd say of the people I'm seeing, at least half to 2/3 probably carry a PTSD diagnosis. I think in terms of substance use, I think some of the data I've seen look at concurrent rates of people who are duly diagnosed with both PTSD and substance abuse, those numbers actually rise in women. A lot of it is just because I think people who've got untreated PTSD are looking for symptom relief. And so some of the symptoms are really debilitating, they're really distressing, and people use substances as a way of coping with those symptoms. So, if you feel really on edge or anxious every time you leave the house because you're expecting to potentially be attacked, it kind of makes sense that you might try to, use a substance that might actually mitigate that anxiety. So people will sometimes use sedatives as a way of kind of just feeling calmer and trying to deal with some of those feelings. The other thing is that when people are actively using substances, they're much more likely to have exposure to traumatic events. Substances are often a way of people trying to treat their psychiatric illness on their own. So then you take away the substance use, and then you have untreated PTSD, for instance. PTSD symptoms actually can get a lot worse. And then, of course, that leads people to relapse because they can't cope with those symptoms.